Also tonight, the Texas Medical Center is telling us it has more than enough beds and equipment to treat patients with COVID-19, but it will only stay that way if we keep doing our part. David Gonzalez breaks it down.
We're learning about the work the Texas Medical Center is doing responding to COVID-19. They sent us over a lot of new information, so let me walk you through it. The Med Center has treated almost 1,100 coronavirus-related patients. A breakdown of that number shows 27% of those patients have been released, while more than 2/3 are still hospitalized. Sadly, 50, or about 4%, of the total number of patients treated through the TMC system have died. Hospitals continue to practice maximum social distancing. Right now, there are about 1,450 ICU beds across the 9 greater Houston counties. 607 of them are available. 58% of the ICU beds are occupied at the moment. 368 are being used by COVID-19 patients, while the rest are non-coronavirus patients. TMC has already planned for almost 1,400 more ICU beds if a surge takes place. TMC admits their ventilator stock would be limited under different social distancing scenarios. They report 136 out of 2,352 ventilators are being used by COVID-19 patients. Another 15% are being used by other patients. And I know that's a lot of information for you to digest, so we posted it all on our website at khou.com for you to check out. Bottom line is, the Texas Medical Center says they are planning and preparing for different scenarios, and right now they do not anticipate any shortages of supplies or equipment as long as we all continue doing our part, which is practicing social distancing.